guys, this is the UCSD Ultrasound team. We're joined today by Dr. Sam Galloway. Dr. Sam Galloway is from the Family Practice Department, and he subspecializes in sports medicine. Today he's going to just teach us a little bit about the topic of a shoulder ultrasound. Dr. Galloway, what do you use the shoulder ultrasound for?
So we use this in clinic both for diagnostic stuff, so we take a look at the biceps tendon, the rotator cuff tendons. We can look a little bit at the bony cortex as well, mainly using it for diagnosing tears or tendinosis or like a bursitis, a fluid accumulation.
So we get patients all the time in the emergency department and they have shoulder pain and we just get an x-ray and it looks okay and we send them out and send them to you. But you might be able to just teach us a little bit about how we can give them a more firm diagnosis. So how do you start with the shoulder ultrasound?
So I always go through a standard procedure as I go through to make sure I'm hitting everything that I know I want to hit as I go through a shoulder ultrasound. So I always start with the patient kind of sitting with their arm just resting in a 90 degrees position here. My probe here is going to be transverse, and what we're trying to find on this initial view here is the biceps tendon sitting in the bicipital groove here. So you'll see the deltoid muscle at the top, you see the bright hyperechoic line of the bony cortex of the humeral head, and then in the bicipital groove, you'll see a hyperechoic circle there, which is the biceps tendon, the long head biceps tendon. So I start here in the bicipital groove, and then I'm going to slide more distal and kind of visualize that biceps tendon coming down until I see the pec tendon line coming across, which you can see is that hyperechoic line there.
Where was the biceps tendon one more time?
So biceps tendon is kind of in the middle there, and then it'll come up and you'll see it in the groove itself right there.
Okay, and that's short axis.
Short axis. Mm-hmm. Here you're looking for either a tear of the biceps tendon, or you can actually see if you see a bright hypoechoic or anechoic fluid accumulation around the biceps tendon. That can be a sign of either a biceps tendonitis, or it can actually be an accumulation of fluid from the joint itself, can kind of come down around the biceps tendon and pool here.
Okay, Dr. Cole, would you mind decreasing the gain a little bit? It comes across as a little hypercoic on the video, but yeah, thanks.
So
okay.
Now that we've seen it in short axis, then I'm going to switch my probe here, and now we're getting a view of the biceps tendon in long axis here. So you're seeing the bright hyperechoic line of the bony cortex, and just on top of that, you're going to see the fibers of the biceps tendon in long axis here, which we can, again, follow that tendon down more distally, and the tendon you're going to see is going to separate out and start to form the biceps muscle belly down here. Yep.
How would you say our fellow Charles's biceps belly looks?
I would say he could use a little more
curls.
Work.
Yeah.
Hammer curls.
Yeah. So then we're going to come back up here. So that's our view of the biceps. You can actually follow it all the way up to where the biceps tendon dives more intra-articularly, and then you're going to lose the very more proximal portion of the biceps tendon.
Okay. What's next?
So now we go back to, this is kind of our home-based view here, where you see the biceps tendon in short axis. And now you're going to have him externally rotate his arm, which is going to now bring our subscapularis tendon into view, the first of the rotator cuff tendons. So,
and that's that right
you're going to see, yes, so tendon shows up as hyperechoic, kind of a dense fibrillar structure, which you're seeing just the distal footprint of the subscapularis tendon here as it attaches on the humeral head.
This whole thing right there, right? Okay.
And if we go more medially, that tendon is going to separate out and you're going to start to see the muscle form there. And deep to that, you can see the humeral head. You can see a little bit of articular cartilage, kind of that anechoic line on the humeral head itself.
Mm-hmm. And so the subscapularis is the first tendon in the rotator cuff that you look at.
Correct.
Okay.
And what you're looking for here is any evidence of disruption of those normal fibers. If it just looks more of a heterogeneous, sometimes you get some hypoechoic lines within the tendon, looking for either a tendinosis, or you can actually see if you had a full thickness tear, you'd see a bright or a dark hypoechoic or anechoic line, and then you'll see separation of the fibers.
Okay, so you're looking for a full tear or even a partial tear on them.
Mm-hmm.
Okay.
And you want to make sure when you're coming, any of these rotator cuff tendons, because the humeral head is round, you want to make sure you're getting your probe exactly perpendicular to the part of the tendon you're looking at, because otherwise it may show up as a false positive for a tear. Whereas if you toggle your probe over and you're perpendicular, so if I'm here, it may look like there's a small little tear on the very distal part of that tendon, that anechoic or hypoechoic there. Whereas if I toggle my probe over now, tip it a little bit more, now all of a sudden that tendon comes into view and you can see that attaching all the way in the very distal footprint.
Kind of the tip of it there. Yeah.
Yep, on the very right side of the screen.
Gotcha. Okay, what's the next?
So from there, there's different ways you can do it, but I let him come back into relaxation. Since I'm here, I kind of just work my way over the top of the shoulder. So I'm going to come across to the top here, and I'm going to take a look, just a quick peek at his AC joint.
Atlantic City.
So you're seeing bone, the clavicle on the left, and the acromion on the right, and you're seeing the space in that AC joint in the middle there.
And so this is the normal AC joint.
Yep.
Whereas if you had an AC separation, would you see one side lower than the other, or would you see them apart?
So yeah, you can see one side will, usually the acromion, one side will drop down a little bit lower.
And fluid in that.
And then you'll see some
space.
fluid, and you can see that bubble up and across the top of the screen.
Gotcha.
You know you're in the right spot if you can see there's a little hyperechoic line at kind of the very deep part there in the joint. If you can see that, then that's kind of the ligament on the underside, and that way you know you're right in the middle of that AC joint.
Okay, cool. And then after that?
From there, now I'm coming back to the posterior side, and what you can do is usually I feel for the spine of the scapula. You're going to come just underneath the spine of the scapula, should be your infraspinatus tendon. Again, you're looking for that hyperechoic fibrillar structure as it attaches on the humeral head there.
Okay.
Yep. So this is the very end, the very distal footprint out here.
And can you show us where the probe is for that infraspinatus one more time? So,
Yep.
Right there. Okay. Interesting. Okay.
So we're seeing a nice looking tendon. You see that fibrillar structure. You don't see any tears or disruption of that normal tendon structure there. And if I scan more medially here, you'll see that tendon form out into the muscle itself. And if you go down a little bit on the depth, decrease the depth or increase the depth on that one, you'll see the muscle there of the infraspinatus. And then we come back around, so tendon, and then here's the view where we get the posterior view of the joint line as well. So now we're looking at the humeral head on the right. Yep. He can bring his arm into internal external rotation, and you can see that moving.
Do that one more time, Charles.
And then you see the glenoid there on the left. Yep. In between, in that little hyperechoic kind of triangle in between the glenoid and the humeral head, is the view of the posterior labrum that we can see at the back of the shoulder.
Is that also where you were looking for nerve impingement as well, or shoulder impingement syndrome?
So shoulder impingement we'll do on the lateral side.
Okay.
But if you're doing a glenohumeral joint injection, this is the view you're coming in, and then you can inject into here as well.
This is also the view that we look at for shoulder dislocations to see if it's out and if you are able to pop it back in, right?
And again, here you can. There's another view of the articular cartilage on the humeral head there. That anechoic line just superior to the bony cortex.
Okay. And then after that.
So from here, now I take him into what's called the modified Cras position, where he's going to put his hand like he's reaching in his back pocket, and you want the elbow to come as far posterior as you can. And now I'm going to put my probe here. I've got my indicator usually kind of pointed towards the patient's ear. And then this, if you go up on the depth a little bit, bring that in the center of the screen, this is his supraspinatus tendon. So again, you want to follow that all the way out to the very distal footprint there. And you can see he's got a little bit of some tendinosis there in that supraspinatus tendon, where you see a little bit of, you don't see that nice fibers coming all the way across. You see a little bit of anechoic structures within the supraspinatus tendon itself. Right in there.
Right there.
Yep.
Oh, interesting. So
Yeah,
this area right here is indicative of tendinosis.
So kind of right in, actually a little bit right in here.
Oh, this stuff right here.
So
Okay.
you should see those fibers coming all the way across.
Ah,
He's got a
I see,
little
yeah.
bit of just not quite as smooth right in the middle of the tendon. Again, nothing torn. I don't see any tears in the tendon itself here, but it just looks like he's got a little bit of what we call tendinosis there. And then we kind of follow that a little more proximal here. Again, you want to scan, once you're here, you want to scan the full anterior portion of the tendon until you see it kind of drop off. And then you just slide posterior this way, again, until you see that tendon kind of drop off the screen there. So that way you know you've gone through the entire length and the entire width of that supraspinatus tendon. On top of, and then you can actually have him come back and again rest neutral. Again, we can get another view of that supraspinatus tendon here. And just superficial to the tendon itself, you'll see a thin line, which is the fluid within the subacromial bursa. Yep. And then just superior to that is that hyperechoic line, which is the actual bursa itself, the tissue. And then on the left side of the screen now, we've got our acromion coming into view. And then when you're checking for impingement, I come into this view.
I go out.
And then I have him abduct his arm.
Let's see that.
And you can see the tendon sliding nicely underneath the acromion.
Mm-hmm.
It doesn't thicken or bunch up. You don't see any fluid accumulation within that bursa itself. So he does not have any signs of impingement on this view here.
So it's just smoothly
moving.
moving through and out.
Yep.
Oh, cool. Okay. All right.
And that is your basic shoulder ultrasound.